Have you ever noticed that no matter how well you manage your arthritis, the right medications, the right doctor, the right plan, something still isn't working the way it should? Your joints still flare. Your medication stops being as effective. You wonder why. What if part of the answer has nothing to do with your joints at all, and everything to do with your weight? Today we are talking about something most arthritis patients have never been told: the connection between body fat, inflammation, and a new class of medications you've probably already heard of: Ozempic, Wegovy, Mounjaro, and why rheumatologists like me are paying very close attention. Before we begin, I just want to remind you that this video is for educational purposes only. It is not a diagnosis, and it does not replace medical advice from your own doctor. Every patient is different, so if you have personal questions about your symptoms, test results, or treatment, please speak with your healthcare provider. Hello everyone, and welcome back to RheumCare. I am Dr. Alvarez, a rheumatologist dedicated to helping patients better understand arthritis, autoimmune diseases, and their treatment options in clear, simple language. Every day in my clinic, I see patients with rheumatoid arthritis, psoriatic arthritis, lupus, and osteoarthritis. And one pattern I keep noticing: patients who also carry extra weight are harder to treat. Their medications sometimes don't work as well. Their pain is worse. Their inflammation is higher. For a long time, we focused only on the arthritis. But now there is a new conversation happening in rheumatology, and it involves these weight loss medications. Let me start with something important. Not all arthritis is the same. Some people have osteoarthritis, that is the wear and tear kind. The cushion inside your joints slowly wears down, like the sole of an old shoe. Your knees, hips, and fingers start to hurt when you move. Others have rheumatoid arthritis or psoriatic arthritis. These are autoimmune diseases. Your own immune system is attacking your joints by mistake. It is like your body's security guard getting confused and fighting the wrong enemy. We have good medications for both, but here is the problem. Sometimes even the strongest treatments stop working. And researchers discovered something that changed everything. Obesity makes arthritis worse, not just because extra weight puts pressure on your joints, but because body fat itself is doing something most people do not expect. Think of your body fat like a factory. A small factory is quiet and does not cause trouble. But when there is too much fat, especially around your belly, that factory starts producing chemicals that travel through your blood and cause inflammation all over your body. These chemicals cause swelling, pain, and make your immune system even more overactive. And here is the problem. It does not matter how good your arthritis medication is. If those chemicals keep pouring out of excess body fat, your medication cannot fully do its job. This is also why some patients need higher and higher doses of their arthritis medications over time, and why those doses sometimes still are not enough. Your weight is directly affecting how well your treatment works. Let me tell you about one of my own patients. I'll call her Sarah. Sarah is 52 years old. She came to my clinic with psoriatic arthritis, high blood pressure, and she was struggling with her weight. She had been on arthritis medications for years, but still had pain. She was tired. She was not moving as easily as she used to. After reviewing her full picture, her arthritis, her weight, her inflammation levels, I decided to add a GLP-1 medication to her treatment plan. Over several months, Sarah lost nearly 50 pounds. But here is what surprised both of us. It was not just the scale that changed. Her joints hurt less. She was moving more freely. Her energy came back. When I checked her inflammation blood tests, they had improved significantly. I was even able to slightly reduce her other medication dose. Was it just the weight loss? Or was the medication doing something more? That is exactly what researchers are working to understand right now. So what exactly is a GLP-1 medication? Forget the complicated science. Here is the simple version. Normally, when you eat, your gut sends a signal to your brain: we are full, stop eating. GLP-1 medications are like a megaphone for that signal. Your brain hears it louder and longer. You feel full sooner. You eat less. You lose weight. Common names you have probably heard: Ozempic, Wegovy, Mounjaro, Zepbound. They were first developed for diabetes. Then doctors noticed patients were also losing significant weight. And now researchers are discovering they may do something else entirely: reduce inflammation directly inside the body. There are 3 ways these medications may help people with arthritis. Number 1, less weight means less pressure on your joints. Every pound you lose takes about 4 pounds of pressure off your knees. Lose 20 pounds and that is 80 pounds less stress on your knee with every single step. Less pressure means less pain and slower joint breakdown. Number 2, they may directly reduce inflammation. A major 2023 study found that GLP-1 medications reduced inflammation markers in the blood. And an October 2024 study followed 400 patients across 11 countries. Patients with knee arthritis using semaglutide, the ingredient in Ozempic, reported a 40-point reduction in pain on a scale of 100. That is significant. Researchers believe these medications may quiet down those inflammatory chemicals released by excess body fat. Less inflammation means your arthritis medications work better. Number 3, they protect your heart. Patients with rheumatoid arthritis and psoriatic arthritis have a higher risk of heart disease because the same inflammation attacking your joints also affects your heart and blood vessels. GLP-1 medications have been shown to reduce heart disease risk. A recent study even showed they reduce the risk of death in patients with rheumatoid arthritis and diabetes. That is a big deal. Now, I need to be very clear about something. GLP-1 medications are not arthritis treatments. They do not replace methotrexate, biologics, or any medication your rheumatologist prescribed. Think of it this way. If your arthritis is a fire burning inside your joints, your arthritis medication is the fire extinguisher. GLP-1 medications help reduce the fuel feeding that fire, but they are not the extinguisher. You need both. Stopping your arthritis medications on your own can cause serious flares and permanent joint damage. Always talk to your rheumatologist before making any changes. Can I ask my doctor about Ozempic for my arthritis? Yes, absolutely. If you have arthritis and also struggle with your weight, this is a great conversation to have with your rheumatologist. Will insurance cover it? It depends. Most insurance currently approves these medications for diabetes or obesity, not directly for arthritis. Your doctor can help you navigate that. Are these medications safe long term? Research so far is encouraging, but we are still learning. Long-term studies are ongoing. What happens if I stop taking them? Weight often returns when the medication is stopped, and with it, some of the inflammation benefits may reverse. This is still being studied. The connection between weight and inflammation is stronger than most people realize. These medications are giving us a new way to think about arthritis, not just treating the joint, but treating the whole patient. Now I want to hear from you. Have you or someone you know tried a GLP-1 medication like Ozempic or Wegovy? Did you notice any difference in your joint pain or inflammation? Drop your experience in the comments below. Your story might help another patient watching this video right now. If this video helped you, please give it a like and subscribe so you do not miss the next one. And if you would like to learn more or connect with our team, visit us at RheumCare.net. Take care of your joints, and I will see you in the next video.